Good morning and welcome to Preserve Health Talks. I'm Dr. Ira Pearlstine, and today I'm with Leah Ginn. Leah has recently joined our practice at Preserve Health MD as an ARNP and DNP, and she's got a whole alphabet of initials behind her name, and she's going to explain to us in just a second what those are. But we're really so happy and so thrilled that she's joined us as a permanent fixture in our practice to help us care better for our community here on the Treasure Coast. Good morning.
Good morning.
How are you?
Good. How are you?
Good. So tell us what your initials stand for,
Yes.
because patients ask that all the time, and they ask me,
Yes.
why are you only an MD, but she's got a DNP and an ARNP, and what does all that mean?
Yeah, so the DNP stands for Doctorate of Nursing Practice, which I got from the University of Florida, and that is just a doctoral degree in nursing. And then APRN is nurse practitioner, so I'm board certified through the state of Florida as an adult gerontology acute care nurse practitioner.
So what made you decide to do all of that? Because prior to this, you were a nurse.
Yes.
And my understanding is that you were working in an intensive care unit setting, and you still do that sometimes. And then you decided to go further. What drove you to do that?
Yeah, so I was a bedside nurse for many, many years. I went through nursing school, and then the pandemic happened, which shifted the way that healthcare was for forever, essentially. And so I was just at the bedside. It was very long hours, 12-hour shifts, nonstop, very chaotic. And so I decided that I wanted to just go on and get the next step in my degree. So I got my doctorate, which just allows for more autonomous practice. So I was able to take a step back from the bedside and have a more, a better work-life balance.
Oh, that's great.
Yeah.
So Dr. Ginn, Leah Ginn, Nurse Ginn, joined our practice in September, and she's building her own practice within our larger group practice to help care for our patients. And we brought Leah in because she's able to offer the same level of care, but at a lower price point.
Yes.
So those who feel that I'm unaffordable can see Leah at a lower price point, but still get that same level of care where we're able to be reached 24/7, same day office visits, and provide you with an entire spectrum of care. So
Yeah.
tell us and tell the audience what you do on a day-to-day basis in our office.
Yeah, so I am able to kind of do anything, A to Z. I love to help out. If it's something as simple as some nasal swabs or blood draws, I love doing those, EKGs. But I also see patients all day throughout the office, and I'm able to do really anything: sick visits, respiratory infections, viral infections, physicals. I can order imaging, I can order medications. I have the same scope of practice as an MD, so there's really no limitations. In the state of Florida, a nurse practitioner can own their own practice, so Dr. Pearlstine and I definitely work together and collaborate. We bounce ideas off of each other, so it's a really good dynamic that we have.
Yeah, we do. We have a good time in the office, and the nice thing is we get to bounce cases off of each other. We've had some complicated cases
Yes,
so far.
we have.
But overall, we just have a really good time in the office, and it makes it really nice. So when I'm not on and I'm away, Leah's on, and when Leah's not on, I'm on. So our patients get to know both of us, and we're both there in the office, and that makes it a really nice thing to do. So as we go further with this, Leah, Nurse Ginn, Dr. Ginn, she's got so many initials behind her name, is going to be in the office 4 days a week. Right now, you're in the office 3 days a week. And as your practice grows, that number will increase to 4 days a week.
Right. And the great thing about concierge medicine is that even if I'm not in the office or you're not in the office, we still have 24/7 access for our patients to contact us. Everything's done basically by a computer nowadays. So as long as we have our laptop with us, we're good to go.
Yeah, that's right. And it's just a pleasure having you in the office, and welcome, and you're just a great addition to Preserve Health MD. So in the last few seconds of our initial podcast, why don't we tell our listening audience what we plan to do together in the future on this podcast?
Yeah, definitely. I think we're just here to spread correct information and debunk any myths that is in the healthcare field, give lots of good information and accurate information.
So our podcast, which will continue to go on, I hope, and will be on our own YouTube channel, and you can find us at Preserve Health MD, we have a website, preservehealthmd.com. And we have Preserve Health MD, our YouTube channel, or you can call our office for information at 772-252-1425. We're available many different ways. But what we want to do on our podcast is bring in guests to talk about novel practices in this area, particularly on the Treasure Coast, and to talk about controversies and newer updates in healthcare. And we hope to bring all of that to you in the future. And we're running out of time on our first podcast, but we hope to see you soon on our next. Anything you want to say to end?
No, I'm excited.
Okay.
Excited to be here.
To our audience, welcome, and we hope you enjoy our podcast in the future. We look forward to hearing feedback from you and seeing you in the office soon. Thank you.